I'm Dr. Sara Grethlein, and I'm a medical oncologist here at the Swedish Cancer Institute. I am focusing on patients with thoracic tumors. That means tumors in the chest cavity. Commonly that's lung cancer or thymic malignancies. In my career, I've taken care of patients with a broad range of cancers. And so I'm looking forward to my work and getting to know patients here at Seattle. So the first time a patient comes to see me, we have a very in-depth conversation. I need to learn about their medical history, and that can include things that don't seem to be directly related to cancer. But I also want to learn about their family history. I want to learn about their habits. I want to learn about who they are as an individual. And in medicine, we would call that a family history and a social history. But for me, it's really the fun part of my job. I want to be treating people, not cancers. I like patients to have the opportunity to get to know me and my style and how I communicate. And we'll do, in addition to that intense history taking, I'll do a physical examination, which helps me understand the patient's current medical status and also the baseline that I may have to adapt any treatment recommendations around. Cancer treatment is changing constantly, and that's part of the fun part, because what I had to tell someone a year ago isn't the same as what I can tell them today. I graduated from my training in 1994, and the vast majority of treatments that I recommend today didn't exist at that time. What's most exciting right now is immunotherapy, and that is helping the patient's immune system fight their own cancer for them. So some people ask, why Swedish? Why should I come to SCI? And it's easy for me to answer that. It's the people, and it's the outlook of the people. They're really interested, we're really interested in wrapping a patient and their family around with support from the first time we meet them through the end of their cancer journey. We have survivorship programs, we have palliative care programs, we've got music therapy, we've got art therapy, we have an amazing nursing and administrative team, and it's really to us about the patient's journey and the patient's experience. This is a scary place to come, and we want to take away that fear and replace it with information and confidence in the people who are working with you and walking with you on that path.